Okay, I'm going to perform a GI assessment on our patient. Of course, you don't need a doctor's order for any kind of an assessment, so I've gotten into the room, I've introduced myself to the patient, done all my wipes, provided privacy. Might need a pair of gloves on just in case, so I'll go ahead and put my gloves on. You definitely want to have the bed up. Before you put the bed up, you want to ask the patient if they need to void, if they need to empty their bladder, if they don't have a catheter in, to make sure that they're comfortable during the procedure. I would also want to know my patient's history. You know, do they have have they had any type of GI surgery in the past? Do they have any problems right now with nausea? When was their last BM? Was it a normal bowel movement? Have they had diarrhea, pain? Anything like that that would help with my assessment. So again, I'll have the bed up so it's comfortable for me, safe for me, and keep the patient safe by keeping up the side rail. Now when you do a GI assessment, we also want the patient to be in a comfortable position, so we would their head up just a little bit, but mainly you want the foot of the bed up, catched up a little bit to take off some of that pressure of the abdomen, the abdominal muscles. After asking my patient about their history, the GI assessment really starts with the oral cavity. So I would look in the oral cavity and just make sure that are the mucous membranes moist, the color, you know, or any problems with their dental problems or anything like that. So that looks fine. So we'll move on to the abdomen now. I'll just pull all this down a little bit so you can see a little bit better. Obviously we would keep the patient's genitalia covered up. Okay, so first we're going to just look at the abdomen. We're going to look for any distension, look for the contour, look at the color. Is there any scars present? Maybe they didn't remember, oh yeah, I had a appendectomy several years ago, an open appendectomy. So look for any scars, look for any petechiae, you know, just anything unusual. Look for any masses. Are there any hernias, umbilical hernia, you know, anything like that? Where is their umbilicus? Is it centered? Do I see any pulsations? Okay, so all that looks fine. So I'm going to go ahead then and auscultate the abdomen, and you're going to divide that up into your 4 quadrants. You're going to start in your right lower quadrant, and we're going to listen in each quadrant until we hear vowel sounds up to 5 minutes. So listen in each one. Okay, they got good vowel sounds. You then want to listen with your bell over the aorta area to see if we hear any bruits. Also over the renal and iliac arteries. Again, just if we hear anything abnormal. Okay, so we've auscultated. And then we want to palpate, and you're going to do that in the same quadrants. Just a light palpation. You don't want to do a deep palpation. Are you having any pain at all when I press on your abdomen? And they don't. After that, then you would percuss. Again, in those same 4 quadrants, just percuss. Seeing if you hear, you know, where you're hearing different sounds, where you hear tympany or dullness. So we have done our abdominal assessment. Of course, we would make sure our patient's covered up, and then we're going to be sure we go back and document all of our findings.